Good morning. I see you're here because you're experiencing pain in your arm. Can you tell me when it started and if you've had any history of blood clots, trauma, or repetitive strain injuries?
我大約2個星期之前開始覺得痛，特別係搬咗啲重嘅盒之後，仲有我右邊膊頭同前臂有腫脹。
It sounds like it could be Paget-Schroetter syndrome, also known as effort thrombosis. This is a rare condition where repetitive movement leads to compression of the subclavian vein, causing blood flow obstruction. Have you also been experiencing numbness, tingling, or weakness in your fingers or hand?
有，我有時會覺得針吉嘅感覺，特別係用咗手臂好耐之後，仲有手經常覺得凍。
These symptoms are consistent with thoracic outlet syndrome, which can cause venous compression. In Paget-Schroetter syndrome, the subclavian vein becomes compressed between the clavicle and the first rib, leading to venous thrombosis. This can impede blood flow, causing the swelling and discomfort you're experiencing.
如果唔治療，呢個情況會唔會變得更加嚴重？佢可以嚴重到咩程度？
If left untreated, Paget-Schroetter syndrome can lead to long-term complications. The thrombosis in the subclavian vein could cause persistent swelling, skin discoloration, and, in some cases, post-thrombotic syndrome, which involves chronic pain and venous ulcers. In more severe cases, the clot can break loose and cause a pulmonary embolism.
我哋可以採取啲咩步驟嚟治療佢？藥物夠唔夠？定係需要做手術？
Treatment typically begins with anticoagulation therapy to prevent further clot formation. We may prescribe medications such as heparin or warfarin, and in some cases, we may recommend thrombolysis, a procedure where a clot-dissolving drug is directly injected into the clot. Surgery may be required if the vein remains blocked or if there is significant vascular damage.
手術有咩幫助？手術具體會涉及啲咩？
Surgical treatment may include decompression of the thoracic outlet. This involves removing the first rib or other surrounding structures that are causing the compression on the subclavian vein. In some cases, we may perform venoplasty, where a balloon is used to widen the vein, or even resection of the vein if it's severely damaged.
我擔心手術後嘅康復過程，我要幾耐先可以恢復正常？
The recovery time can vary. If the surgery involves rib resection or thoracic outlet decompression, you may need several weeks to a few months to fully recover. After surgery, physical therapy is often necessary to restore movement and strength to the shoulder. Most patients can return to normal activities within 6 to 12 weeks, but it's important to avoid heavy lifting or intense physical activity during the recovery period.
手術有咩風險？有冇潛在嘅併發症我應該留意？
The risks include infection, bleeding, nerve injury, and blood vessel damage. There's also a small risk of recurrence of the condition, especially if the underlying compression isn't fully relieved. However, the risk of complications is low, and the majority of patients experience significant improvement after surgery.
呢個病做完手術之後會唔會復發？
Yes, while the surgery can effectively relieve the compression, there is a chance that the symptoms could return, especially if the surrounding muscles or tissues aren't strengthened enough during rehabilitation. It's important to follow the physical therapy regimen closely to reduce the risk of recurrence.
如果唔需要手術，喺服藥期間點樣管理症狀？
If surgery is not necessary, managing the condition conservatively with anticoagulant therapy and physical therapy is often effective. You may also be prescribed pain management medications such as nonsteroidal anti-inflammatory drugs. Additionally, we'll work on improving posture and reducing the strain on the shoulder muscles through stretching exercises and strengthening routines.
我需唔需要調整日常活動，例如工作或者運動？
Yes, for the time being, I recommend avoiding activities that require heavy lifting or repetitive motions, particularly those that put strain on the shoulder. You should also try to avoid positions that compress the thoracic outlet, such as raising your arms above your head for long periods. Low-impact exercises like swimming or walking are generally safe, but we'll tailor your activity level to your specific recovery needs.
你會點樣監察我嘅病情，確保治療有效呢？
We'll start by monitoring your symptoms closely, checking for improvements in swelling, pain, and tingling. Additionally, we'll conduct ultrasound exams to assess blood flow and check for any remaining clots. In some cases, we may also perform a venogram to get a more detailed view of the veins and blood flow. Regular follow-ups will help ensure that the treatment is effective.
我應該留意啲咩症狀嚟知道病情係唔係惡化？
You should monitor for any increase in swelling, redness, or warmth in your arm, as this could indicate the clot is growing or there is an infection. Severe pain, difficulty moving the arm, or the sudden onset of shortness of breath or chest pain could be signs of a pulmonary embolism, which would require immediate attention.
有啲咩我可以做嚟預防以後再發生？
Preventing recurrence involves avoiding repetitive trauma to the shoulder and maintaining good posture. Strengthening exercises for the upper body, especially the shoulder muscles, can help prevent compression of the thoracic outlet. Maintaining a healthy weight and staying active will also improve circulation and reduce your risk of blood clots.
我有冇風險發展成其他同靜脈或者循環系統有關嘅併發症？
Yes, if the venous compression is not fully relieved, you may develop chronic venous insufficiency or other vascular issues. It's also possible for the blood clot to lead to chronic pain, swelling, and skin changes, especially if there's damage to the veins over time. We'll continue to monitor for these complications and adjust your treatment plan as necessary.
如果我出現肺栓塞會點？我點樣知道？
Symptoms of a pulmonary embolism include sudden shortness of breath, chest pain, rapid heartbeat, and sometimes coughing up blood. If you experience any of these symptoms, you should seek emergency care immediately.
有冇可能會發生喺我另一隻手？
It's possible but less common unless you engage in similar repetitive movements with the other arm. If you have a predisposition to clotting or anatomical abnormalities on both sides, the risk might be higher.
多謝醫生，我好感激你提供嘅資訊。
You're welcome. We'll now perform diagnostic imaging to confirm the diagnosis. A Doppler ultrasound is often the first step because it helps visualize blood flow in the vein and detect any clots. If necessary, we may follow up with a CT venogram or Mr. venogram for more detailed imaging of the veins and surrounding structures. These tests will also help us determine the extent of the compression and clot formation.
我需唔需要驗血？
Yes, we'll order blood tests to check for clotting disorders, such as factor V Leiden or antiphospholipid syndrome. These tests will help us understand if you have an underlying predisposition to forming blood clots.
其實我今朝食咗早餐，會唔會影響抽血檢查額？
It's not a major issue for most tests, but for certain blood work, especially those related to coagulation, it's usually best to fast for at least 8 hours before the test. However, since we're primarily checking for clotting disorders, eating should not interfere with the results. I'll make a note for the lab to ensure they take that into consideration. If any tests require fasting, we can reschedule them for another time.
我可唔可以繼續上班，定係應該休息一陣？
It depends on how severe your symptoms are. If you're able to manage your symptoms and the swelling isn't too bad, you can continue with light duties that don't strain the arm. However, if you're lifting heavy objects or performing tasks that could aggravate the condition, I would advise taking time off to rest and allow the treatment to work.
我而家開始有冇任何飲食限制，定係可以照常飲食？
If you're on a medication like warfarin, you'll need to maintain a consistent intake of vitamin K. Foods like leafy green vegetables, broccoli, and spinach are high in vitamin K, so you don't have to avoid them entirely, but you should keep your consumption steady. For other blood thinners, there are fewer restrictions, though it's still wise to limit alcohol. We'll talk more about your specific medication once we decide which is most suitable for you.
點解我需要特別小心維他命 K？
Vitamin K plays a key role in the blood clotting process. Warfarin works by blocking vitamin K's action to reduce clot formation, so sudden large fluctuations in your vitamin K intake can affect how well the medication works. If you consistently consume about the same amount every day, your dosage can be balanced accurately.
多謝醫生。
You're welcome. We'll work together on a treatment plan to help you recover fully. If you have any questions or notice changes in your condition, don't hesitate to reach out.